Chapter 3 is diseases of the blood and immune mechanism. Their code range D50 through D89. Currently, there's no chapter-specific guidelines for this section, but there is an excludes to note that precludes codes from this chapter to indicate that certain disease processes or illnesses from other chapters can be coded if both conditions do exist. Anemia is a condition that develops when your blood lacks enough oxygen for healthy red blood cells. The cells are the main transporters of oxygen to the organs. If red blood cells are also deficient in hemoglobin, then your body isn't getting enough oxygen. Symptoms of anemia, like fatigue, can occur because organs aren't getting what they need to function properly. Nutritional anemias refer to those types of anemias that can be directly attributed to nutritional disorders. Nutritional anemias are coded for the range D50 through D53. Hemolytic anemia is a condition in which there are not enough red blood cells in the blood due to premature destruction of red blood cells, and they're coded to code range D55 through D59. For example, after lab testing, the patient was determined to suffer from Biermer's anemia and is scheduled to receive vitamin B12 injections. This is an anemia that's due to lack of vitamin B12, and in ICD-10, this is coded to D51.0 for vitamin B12 deficiency anemia due to intrinsic factor deficiency. Vitamin B12 deficiency is most often due to a lack of substance called intrinsic factor. Intrinsic factor is a protein secreted by the stomach that joins vitamin B12 in the stomach and escorts it through the small intestines to be absorbed by the bloodstream. Without intrinsic factor, vitamin B12 can't be absorbed and it leaves your body as waste. Biermer is an eponym. It's a disease named after the person who discovered it or suffered from it, and you can find many eponym terms in the alphabetic index. So in this case, Biermer's anemia is found by looking for Biermer's or pernicious anemia or disease, which is code D51.0. Sickle cell disorders are located under category D57 and are broken down by type and whether crisis is present. Code block D60 through D64 contain codes for aplastic and other anemias, including anemia in chronic diseases classified elsewhere and secondary anemias. Note that D63.1 is coded second due to the code first note that's associated with it. The note says to code first any associated underlying chronic kidney disease, which is category N18. Neutropenia is an abnormally low count of neutrophils, which are white blood cells that help your immune system fight off all kinds of infections, particularly things like bacteria and fungi. You have several types of white blood cells, and between 45 and 70% of all white blood cells are neutrophils. So, for example, a patient presents with fatigue, weight loss, they're unable to eat large meals. The patient also complains of discomfort in the upper left side of the abdomen. The provider performs an exam and orders an ultrasound and lab tests. After reviewing the diagnostic studies, the final diagnosis is documented as hypersplenism, and then we assign code D73.1 for hypersplenism. Chapter 4 contains codes for endocrine, nutritional, and metabolic diseases, and these are code ranges E00 through E89. One of the biggest challenges in this chapter is coding for diabetes mellitus. And although other conditions, such as disorders of the thyroid gland and glucose regulation and pancreatic internal secretions are in here, diabetes is usually the biggest focus. Diabetes mellitus is a condition that occurs when the body can't use glucose normally. Glucose is the main source of energy for the body's cells. The levels in glucose in the blood are controlled by a hormone called insulin, which is made by the pancreas. Insulin helps control glucose in the cells. In diabetes, the pancreas does not make enough insulin, which is type 1 diabetes, or the body can't respond normally to the insulin that's made, which is type 2 diabetes. This causes the glucose levels in the blood to rise, leading to symptoms such as increased urination, extreme thirst, and unexplained weight loss. Diabetes mellitus is a chronic disease that causes serious health complications, including renal failure, heart disease, stroke, and blindness. Studies from 2015 estimated that about 30.3 million people in the United States had diabetes mellitus, of which approximately 1 million have type 1 and the rest all have type 2 diabetes. Type 1 diabetes is due to pancreatic islet B cell destruction, predominantly by an autoimmune process, and these patients are prone to ketoacidosis. Diabetic ketoacidosis occurs when the body cannot use sugar or glucose as fuel because there's no insulin or not enough insulin. Fat is used for fuel instead. Byproducts of fat breakdown called ketones build up in the body, and high levels of ketones can lead to a coma. Type 2 diabetes is the more prevalent form and results from insulin resistance with a defect in compensatory insulin secretion. With type 2 diabetes, the body either resists the effects of insulin, which is a hormone that regulates the movement of sugars in your cells, or it does not produce enough insulin to maintain normal glucose levels. The creation of expanded combination codes allows for multiple conditions to be indicated with fewer codes reported, and there's some examples here on the screen. Instead of one category for diabetes, there's actually 5, and they're broken out by the type of diabetes, such as due to an underlying condition, drug, or chemical, type 1, type 2, and other specified. The guideline states that the default code is type 2 if the provider does not document correctly or provides unclear documentation as to the type. Diabetic codes are combination codes that include the type of diabetes, the body system affected, and the complication affecting the body system. All the categories above, with the exception of E10, include a note directing users to use an additional code to identify insulin use, which is code Z7984, or use of anti-diabetic or oral hypoglycemic drugs, which is code Z79.84. Code Z79.4, which is long-term current use of insulin, is added to identify the type of insulin for diabetic management, even if the patient is not insulin dependent. So let's look at an example. A 45-year-old diabetic patient returns to his physician's office for a 3-month follow-up visit. The patient has no complaints. After an expanded problem-focused history and physical examination, the physician documents in the medical record: diabetes well controlled with Lantus, diet, and exercise. Patient will continue the same medication dosage, monitor glucose levels with home monitoring system, and return in 3 months for a recheck. The first listed diagnosis, E11.9, type 2 diabetes mellitus without complication, and the second code, Z79.4, long-term use of insulin, are used. Since the documentation states that the patient is diabetic but doesn't specify that type, it is coded to type 2 diabetes with that E11.9. Since it is a type 2 patient that's using insulin, we also need to append that Z79.4 for long-term recurrent use of insulin. Sequencing of the diabetes codes in the range of E08 through E09 have a code first note indicating that the diabetes is supposed to be sequenced after the underlying condition, drug, or chemical that is responsible for the disease. Remember, the diabetes codes are combination codes that include that type, the system infected, and the complications affecting the body system. So the combination codes might actually simplify the number of codes that we're going to be submitting. So let's look at an example. A type 1 diabetic patient with Kimmelstein-Wilson disease visited his endocrinologist in follow-up. The diagnosis would be for E10.21, which is for type 1 diabetes mellitus with diabetic nephropathy, which includes Kimmelstein-Wilson disease. When assigning the type of diabetes, remember that age is not the sole determining factor, although a lot of type 1 patients develop the condition before reaching puberty. Although, if the type of diabetes is not documented, you will default to type 2 diabetes. The code for long-term use of insulin should not be used if insulin is given temporarily to bring a type 2 diabetic patient's blood sugar under control during an encounter. And then remember, those codes for pregnancy and childbirth, etc., those OB codes always take sequencing priority, even for those diabetic codes. The codes for diabetes mellitus in pregnant patients really expanded in ICD-10, and the fourth character subcategories identify the type of diabetes, such as if it was pre-existing or type 1 or type 2. So let's take a look at an example. A 25-year-old patient with diabetes mellitus type 1 in her second trimester at 18 weeks visited her OBGYN for her routine follow-up visit. The patient's blood sugar was well controlled, and the patient indicated she was doing well with her diet and exercise regimen. The physician scheduled the patient for follow-up for 1 month. The first listed diagnosis would be 024.012 for pre-existing diabetes mellitus, type 1, in pregnancy, second trimester, and then the second listed code would be Z3A.18 for 18 weeks gestation of pregnancy. For secondary diabetes mellitus, we have categories E08 for diabetes mellitus due to underlying condition, and E09 for drug or chemical-induced diabetes mellitus. Secondary diabetes is always caused by another condition or event. The codes identify complications and or manifestations that are associated with secondary diabetes mellitus. An underdose of insulin due to an insulin pump failure should be assigned a code from that subcategory T85.6, which is mechanical complications of specified devices, implants, etc., and that specifies that there's a pump malfunction. That should be the principal diagnosis code. You would then assign the code from a subcategory T3 8.3XA for the underdosing of insulin or oral hypoglycemic drugs. And then you use an additional code to determine the type of diabetes mellitus and any associated complications due to the underdosing. Utilize the codes for obesity and BMI if they're documented. If no cause of obesity is indicated, the default ICD-10 code is E66.9, obesity unspecified. The provider does have to document obesity. It can't be assigned just based on the BMI alone. For example, a 26-year-old patient presents for consultation for bariatric surgery. The physician documents that the patient was counseled on controlling her caloric intake and set up with a dietitian. The patient eats in excess of 3,000 calories a day and doesn't exercise. Her weight is 290 pounds, and her BMI is documented at 49.78. So we assign code E6601 for morbid obesity due to excess calories, and Z68.42 for body mass index 45.0 through 49.9 in an adult. Chapter 5 contains codes for mental, behavioral, and neurodevelopmental disorders. The codes in this chapter are ranges F01 through F99. For patients documented with mental and behavioral disorders that are due to psychoactive substance use, if the provider's documentation refers to use, abuse, and dependence of the same substance, such as alcohol, only one code should be assigned based off of this hierarchy, and we'll talk about the hierarchies. So if both use and abuse are documented, we only assign the code for abuse. If both use and abuse are documented, assign only the code for abuse. If both abuse and dependence are documented, assign only the code for dependence. If use and dependence are documented, default is dependence. If use, abuse, and dependence are documented, default is dependence. For example, patient presents to the ED with obvious disinhibition and aggression after showing impaired judgment in a bar. He was brought in by some friends because he kept repeating the same question and was diagnosed with acute alcoholic intoxication with delirium. We would assign code F10.121 for alcohol abuse with intoxication delirium. Schizophrenia is a complex illness. Mental health experts are not sure what caused it. However, they think genes kind of play a role. Schizophrenia affects both men and women equally. It usually begins within the teen years in your adulthood, but it may begin later in life. And it tends sometimes to begin later in women, and in women is a little bit more mild. Depression alone affects over 20 million people in the United States, and it is a disorder of the brain. There's a variety of causes. They could be genetic, environmental, psychological, there could be biochemical factors. Usually depression starts between the ages of 15 and 30, and it is more common in women than it is in men. Depression is a mental illness that can be costly and debilitating to sufferers, and depression can adversely affect the course and the outcome of common chronic conditions. Depression can also result in increased work absenteeism, short-term disability, and decreased productivity. In ICD-10-CM, depression is classified by episodes in addition to types such as mild, moderate, and severe, and with or without psychoactive features. So for example, we have code F33.0, which is major depressive disorder, recurrent mild. F33.41, major depressive disorder, recurrent in partial remission. Bipolar disorder is a serious mental illness in which patients have dramatic mood swings with normal moods in between those dramatic swings. That up feeling is called mania, and that down feeling is called depression. It can run in families, usually starting in late adolescence or in early adulthood. And it's classified as to whether the patient's episode is currently hypomanic, manic, with psychotic symptoms, or without psychotic symptoms. So for example, F50.02 is anorexia nervosa, binge eating, purging type for our behavioral syndromes. For our behavioral syndromes, which are eating disorders and sleep disorders that are not due to substance abuse, we have some listed here, such as F50.02, which is anorexia nervosa, binge eating and purging type, F51.12, which is insufficient sleep syndrome, and F52.0, hypoactive sexual desire disorder. With intellectual disabilities, there are limits to the ability to learn at the expected levels, and it can be caused by a problem that starts anytime before the age of 18 or even before birth. So for example, F72 is severe intellectual disability, which is IQ's levels 20 to 25 to 35 to 40. And that's severe mental subnormality. With attention deficit hyperactivity disorder, or ADHD, patients have problems with inattentiveness, overactivity, impulsiveness, or a combination of all of that. It is the most common diagnosed behavioral disorder in childhood, and it affects about 3 to 5% of school-aged children. It's diagnosed more often in boys than in girls and may run in families, but it's not clear exactly what caused it. Coding for ADHD is by type in ICD-10-CM, so we have predominantly hyperactive, inattentive, or a combined type. Chapter 5, there are a few guidelines in this chapter that mostly focus on pain disorders related to psychological factors. In ICD-10-CM, guidelines indicate to assign the code F45.41 for pain that is exclusively psychological. You would use code F45.42 for pain disorders with related psychological factors, following an appropriate code from the G89, which would be the pain code, pain not elsewhere classified, if there is a documentation of psychological component for a patient who suffers from acute or chronic pain. In this chapter, we have also disorders of adult behavior, such as things like pathological gambling, fire setting, and stealing. Fictitious disorder is falsification on physical or psychological symptoms without an obvious external incentive. The motivation for this behavior is to assume that sick role. A fictitious disorder can be imposed on oneself, or it can be imposed on another person, which is referred to as MSBP, or mucosian syndrome by proxy. You may be familiar with this by the very famous case right now of Gypsy Rose, who was a victim of this condition. When it's imposed on itself, it's reported with a code from subcategory F68.1, fictitious disorder imposed on self. When it's imposed on someone else, like in the case of Gypsy Rose, that would be F68.A, fictitious disorder imposed on another, and it is reported on the perpetrator's record. The victim's record should reflect a code from subcategory T7.4, adult and child abuse, neglect, and other maltreatment confirmed, or T7.6, which is adult and child abuse, neglect, and other maltreatment suspected. Chapter 6 contains the codes for diseases of the nervous system and are coded with the range of G00 through G99. There's not a lot of guidelines in this chapter. The codes for some conditions contain laterality, but even when the code does not include it, the documentation is still important for the code selection. If the affected site is documented, but it is not specified as dominant or non-dominant, the classification does not indicate a default code. The selection would be for ambidextrous patients, the default would be dominant. For if the left side is documented, the default is non-dominant, and if it's the right side is documented, the default is dominant. For general coding of pain, if the pain is not specified as acute or chronic or post-thoracotomy, post-procedural, or neoplasm related, you would not assign a code from G89, pain not classified elsewhere. But a code from category G89 should also not be assigned if the underlying or definitive diagnosis is known, unless the reason for the encounter is pain control or management and not the management of that underlying condition. When the admission or encounter is for a procedure that is aimed at treating the underlying condition, it should be assigned as the principal code, and no code from G89 should be assigned. The codes from category G89 can be used as principal diagnoses under certain circumstances, such as when pain control or pain management is that reason for the encounter, or if the patient is admitted for the insertion of a neurostimulator for pain control. You can use the codes from category G89 to identify the site of pain if the codes from that category provides additional information. There is no need to use one of those additional codes, though, if it does not. If the patient is being seen for pain control or pain management, you would assign the code from the G89 categories first, followed by the codes that identify the specific site of pain. However, if the encounter is for any other reason and a definitive diagnosis has not yet been confirmed, you would assign the code for the specific site of the pain first, followed by the code from the G89 series. For post-operative pain, the default for post-thoracotomy and other post-operative pain is not specified as acute or chronic. You would code it as acute. So if it doesn't say acute or chronic, it's acute by default. As expected, routine or expected pain immediately following a surgical procedure should not be coded. For example, if a patient's like 4 hours post-op from their hysterectomy and experiencing pain, you're not going to code that pain because it's kind of expected that the patient's going to have post-operative pain. If post-operative pain is not associated with a specific post-operative complication, it would be coded to the appropriate code from category G89. When post-operative pain is associated with a post-operative complication, you would then code the appropriate code from Chapter 19, which is the injury, poisonings, and certain other consequences of external causes. So there's no set time frame for when the pain becomes chronic pain, and it's just going to be determined based off of what the physician's clinical documentation is. Chronic pain is classified to subcategory G89.2. If pain is documented as being related or associated or due to cancer, regardless of the status of the neoplasm, you would assign code G89.3, regardless of if the pain is acute or chronic. Central pain syndrome is a neurological condition caused by damage to or dysfunction of the central nervous system, which includes the brain, brainstem, and spinal cord. This syndrome can be caused by stroke, multiple sclerosis, tumors, epilepsy, brain or spinal cord trauma, or Parkinson's disease. The character of the pain associated with this syndrome differs wildly among individuals, partly because of the variety of potential causes. So central pain syndrome may affect a large portion of the body or may be restricted to specific areas such as the hands or the feet. In ICD-10-CM, central pain is coded to G89.4, and chronic pain syndrome is coded to G89.4. Chronic pain syndrome is not the same as chronic pain and should not be coded unless the physician documents syndrome. It very specifically has to say syndrome. Believe it or not, 28 million people suffer from migraines, and the majority of them are women. Migraines are more intense, pulsing, throbbing headaches located on one side of the head. Symptoms that accompany a migraine are usually nausea, vomiting, sensitivity to light and sound. Migraine attacks can last for hours or even several days. Migraines with an aura are when one has a warning sign that a migraine is about to happen, and they could be signs like visual disturbances or blurred vision, flashes of light, zigzaggy lines, temporarily vision loss, or visual hallucinations. Those are things that could be an aura for a migraine. Code selection is based on the type of migraine headaches as documented by the provider.